Hello. So this is clinical reflection number 9. Um, just going to talk about a patient today. We had a 65-year-old female. She was admitted for a bulging disc. She was actually a transfer. So she came from a different location. I believe it was Clay Ascension. So she came from there. She came to see our neurosurgery and then the nephrology as well. She does have a history of chronic lower back pain, and that's most likely due to that disc because it is in her lower back area where she's feeling most of that pain, and where she did recently have a previous procedure to that. She also has a history of multiple sclerosis as well. So the thing with her was focused on mainly pain management until she was to go to her procedure, or if they were to confirm that she would have a procedure. So she was going to be NPO at midnight. So that's something that we had to let her know as well. Um, I would say her pain, it did generate on her left side, more left side of her lower body. She had numbness in her lower left side. So that was something that led to her having an unsteady gait. So she was a major fall risk. So we had to get her wristbands. We had to make sure we assisted her if she needed to get up and use the restroom. Or anything. So, for safety measures for her, all of her personal belongings, call light, everything was within reach for her. However, a cool thing is we got to take her to get an MRI, so I was able to see that. Um, you couldn't stand in the room, obviously, so there's another room behind the actual MRI room that they do the procedures. So we stood behind the glass so we wouldn't, anything wouldn't go wrong. So it was a pretty quick it was pretty quick, not too long. But I just saw how they, laid her down, did the images, and everything. So with her, that was for her spine. She did have a procedure the next. She needed to get another one done, but she didn't get it that time. She needed another one for her brain. But she was just still experiencing that weakness in her body. So that was a big issue. So we were just trying to um, make her comfortable so she's not experiencing any discomfort further or any pain on that left side as well. So this patient, she was our only new admission today, so it wasn't much going on. Our previous patients, we had them the other days, so I know exactly what was going on with them. Um, it was just continuously monitoring for them, comforting measures, and just waiting for their discharge orders from their provider. Um, I did got to feed one of my patients through a tube. Um, he had to get that through a tube because he was NPO through mouth, so he couldn't get anything by mouth. So that was a good learning experience for me as well, feeding someone through a tube and just seeing how you have to be delicate with it because it is going straight into their stomach instead of having them to go through the process of chewing it. So just being gentle with him and making sure I'm flushing that tube just to make sure everything is flowing through that tube properly and how it should be so things just don't get occluded. Going forward, today was a good day. I did learn a lot about imaging, the MRI machine, just based off me walking the patient, not walking, but like rolling the patient down in their bed with me and my nurse, just taking the patient there, seeing how they do things, asking questions to the technicians down there. So that was a good experience for me. Thank you.